10 years ago, maybe 15 years ago, I'd see the odd male coming through, you know, a few husbands, partners, whatever, and they would be having some kind of, or discussing some kind of cosmetic treatment. But things have really changed in the industry over the past few years, where we're seeing a lot more males coming through the door. What perhaps one would consider quite young too, probably guys in their sort of late 20s, early 30s, right the way up through to more mature men. And I think that's the influence of the media. I think it's good that men are looking after themselves and not being embarrassed to feel that they can maintain and look after themselves. And in our younger age category male, they're looking at preventative stuff. They want to look the same, really. They don't really want to change anything about the way they look. They just don't want to look like they're aging particularly fast. So these are the kind of age category that might be looking at very, very light muscle relaxing treatments to stop them looking too frowny and too harsh. Or they may be looking at just some light laser treatment, really, just to keep the skin looking healthy. Males are prepared to invest in preventative treatments to keep them looking really, really good, which is fantastic. So it's no longer perceived to be the domain of females. And then, of course, probably the largest sort of group of people are between sort of 45 and 60, men that are seeing the signs of ageing. They're working in a high pressure environment often. They need to look really, really good. They need to present themselves very, very well. And these are the guys that are perhaps embarking on more intervention, maybe a little bit of light filler, because a lot of these guys are going to the gym. They're working out, they're fit guys, but I don't know whether you've heard of this term gym face, but often you can get sort of volume loss in the mid-cheek here with guys that are fit and working out. So these guys will often be looking at maybe the option of some form of light filler just to restore that volume loss. And again, normally one big popular treatment with this age category is non-surgical skin tightening, like all therapy. Mainly because it works very, very well on men. It gives a bit of a lift, a bit of support, makes it all look, you know, very, very healthy. The facial features look really good. And they seem to get slightly quicker results than women, which is interesting. The other key thing for guys, I mean, it's the same for women too, but the key thing for men, because they can't wear makeup, because they can't cover any marks or telltale signs of treatment being done with makeup, they want something with no downtime. They want something in, have a treatment, go back to the office or go back to what they do with no evidence of anything being done. So actually having something like a skin tightening treatment, like all therapy or thermage, there is no downtime. They can have it done, go back to the office, and it gradually kicks in, very, very gradually, over about 6 to 8 to 12 weeks and gets better. So there's no immediate effect. So nobody's saying, what have you done? What are you doing? It just looks better and better over that time. So for a lot of men, that is their preferred option.